Hello everyone, my name is Dr. Toluwani Rakowska-Falaye and welcome to Medication Africa, basic medical education and life-saving tips for Africans by Africans. Today I'm going to answer some of your questions. Firstly, I want to thank all of you for supporting us by watching our content, sharing and subscribing. We really appreciate all your support. So now on to our questions. The first question is it possible to do CPR on yourself? This question was asked during our choking video, and it's a very good question because in our choking video, we showed you how you can do the Heimlich maneuver on yourself when you're choking and nobody is around. So our subscriber was wondering if it's possible to do CPR on yourself. The answer to that is no, you cannot do CPR on yourself. There are some videos floating around on the internet about something called cough CPR. In cough CPR, they claim that you can perform CPR on yourself by coughing very hard and breathing in deeply. But there's actually no scientific or medical basis behind this. It is not possible to do CPR on yourself. Remember, when we do chest compressions, we're basically taking over the job of the heart. So the force that we are applying on the chest is what allows blood to be pumped throughout the body. When you cough, you're not able to generate enough force to be able to pump the heart sufficiently and regularly enough to pump blood throughout the body at a regular rate. So coughing does not substitute for chest compressions. Again, it is not possible to do CPR on yourself. If you're in the situation where you think you might be having a heart attack, the best thing you can do is shout for help. And if you have your phone on you, quickly call emergency services. The next question is, should we always give rescue breaths? This is another very good question. If you've taken a CPR course in Western countries, they often tell you that you should do rescue breaths if it is safe for you to do so. Some CPR courses will even tell you that rescue breaths are necessary. But do you remember why we do rescue breaths? We give rescue breaths to basically ensure that the person is getting the oxygen that they need. If the person isn't able to breathe, it means that there's no oxygen going into their blood. And as you know, oxygen is very important for us. We live because we breathe in air, which has oxygen in it. But rescue breaths require you to put your mouth over the patient's mouth, and by doing that you can expose yourself to a wide variety of infectious diseases, which is very dangerous for your health. Aside from that, if the person vomited just before they collapse, you also expose yourself to their vomit, which is very unpleasant. This is why some CPR courses don't place such a huge emphasis on rescue breathing. But it is important to note that rescue breaths are still part of the CPR protocol. If you look up the protocol for CPR, it says 30 chest compressions to 2 rescue breaths. In some countries, when you call emergency services, the ambulance will usually arrive in about 3 to 5 minutes. So as long as you're doing your chest compressions properly, then if you're not able to give rescue breaths or you don't feel safe to do so, it might not be such a big of a deal. But in many African countries, emergency services are slower to arrive either due to traffic or poor road conditions. This means that if you don't give rescue breaths, by the time emergency services have arrived, the person may have been without oxygen for around 30 minutes. And this is incompatible with life. Nobody would be able to survive for 30 minutes without oxygen, even if your chest compressions are great. This is why rescue breathing is still part of the CPR protocol. You can easily overcome this problem by using filters, shields, or masks. You can purchase these filters or shields or masks. You can purchase them online or at your local pharmacy, and they're very cheap. They're disposable, so you only use them once and then you throw them away, and they're small enough to fit into your pocket. These filters or masks or shields allow you to breathe air into the patient's mouth without anything from their mouth getting into your mouth. So they basically allow you to give air to the patient, but they also protect your own health. I really encourage everyone to buy one and carry one around with them because, as I said, they're very cheap and they can fit into your pocket. And this is a way that you can help your patient without having to put your own health at risk. If you don't have a mask, a filter, or a shield, it's up to you to decide whether you'll give rescue breaths. Remember, rescue breaths are still part of the CPR protocol. However, your safety as a rescuer comes first. And it's important to remember to never do anything that could pose a danger to you or your health. So if you don't feel comfortable to do rescue breaths because you're not sure about the person's health status, or because it's in a time where we have a lot of infectious diseases going around, for example, during COVID, then don't do it. The third question is, how will we know if CPR worked? Will the person start moving again? This is a very good question. Sometimes a person will start moving again, sometimes they won't start moving again. But actually, it's not up to you to decide whether CPR has worked. You should wait until professionals arrive and they're able to take over. Sometimes CPR has worked and the person starts to come to life again, but the signs of life are very subtle, meaning that you wouldn't be able to tell that they're coming to life again. Maybe their heart will start pumping on its own again, and you'll be able to feel a weak pulse. Maybe they'll be able to breathe by themselves again, but you probably wouldn't be able to tell. This is why you should continue CPR until medical professionals arrive, because they're the ones who are going to decide what to do next. Obviously, if the person starts moving and they start pushing you away and they don't want you to touch them, then stop CPR. It means that your CPR worked, so just stop it and wait for emergency medical services to arrive. The last question is, if the person returns to normal, should they still go to the hospital? Yes, they should still go to the hospital because they need to be assessed. The doctors need to monitor them because whatever caused them to have that cardiac arrest in the first place could and probably would happen again. The doctors also need to figure out why they had that cardiac arrest and treat them. So if somebody starts moving about again after needing CPR, they should go to the hospital. They shouldn't go home. They should go to the hospital and be checked out. So I hope I've been able to answer some of your questions about CPR, and thank you once again for supporting us. If you have any more questions about CPR or anything else, or if there are any topics you would like to see, please leave your comments below and we will be sure to respond.